Hi, I am Winter, and welcome to Bipolar Bazaar. Today is, I think it is June 1st, and 2022. So, yesterday we had a conversation about people that were bipolar, famous people that are bipolar, who went on to have successful careers, and identifying what some of the symptoms of bipolar are, and to take a look at the people around you and yourself, and how you can help yourself and other people. I had a terrible day today. It was not a good day for me today. I had some terrible anxiety. My triggers are, with anxiety, are brought on by some things that I really don't know that happen. I have to always figure them out. But my comorbidities with my bipolar are ADHD, dyslexia, chronic migraines, depression, and I can never remember all of them because I don't like to think about them, but I know that they exist. But what happens with bipolar is that anything can happen at any time suddenly, and that's the problem with bipolar. A person is diagnosed with bipolar. It takes so long to be diagnosed because, as I stated earlier in one of the first videos, is that there are 4 different types of bipolar. So you have to keep going back to the doctor time after time after time, and this could take months, even years, to be diagnosed as being bipolar. And during that time, you're taking different kinds of medications, saying, well, this one doesn't work, that doesn't work, and you're just going up and down and up and down. My psychiatrist said to me, I asked him one time, I said, how did you finally determine that I was bipolar? And he said, because one week you would come in and you would be crying, and the next week you would just be so happy and you would be like, oh my gosh, no, everything is turned out okay, everything is fine. The next week you would come in and you would be crying again. And he said, and also, whenever you walked out of the door and you turned around, you would knock my lamp over. And I was like, oh my gosh, because I would just jump up out of the chair and just turn around and go out the door, not paying any attention to my environment around me. So once I was diagnosed as being bipolar, this was with my neurologist and having these chronic migraines. It all started to come together for me, but it still took a long time after getting off of all of those medications that I had been put on just to get out of pain. I had to go in the hospital and get on one medication and get on a drip until the medication took. And once they saw what the dosage was, they took that dosage, put it into a pill form, and that's what I take every night before I go to bed. It's called a prophylactic medication so that I don't get migraines anymore. What I do get is intermittent migraines every now and then. I might have a migraine. I was migraine free for almost 5 years until 2019, when I had an accident and got a concussion, and it triggered the migraines, but a different type of headache. So I've been going to treatment for that. Now today, I'm going to tell you about what happens when I am triggered with anxiety, when something happens, and a normal person would not react this way. Some people react this way all the time when anything happens. They're just hyper all the time, and when something happens, they just flip out and just like the world is going to end, and they don't know how they're going to fix it, and everybody sees them go through that. It's normal for them. It's acceptable behavior. Everybody knows that that's not how it's supposed to be, but some people are like that. I'm not like that. So when it happens to me, I know that there's something wrong. So I got up today and I was okay. Had a lot to do, but I was okay. Then I had to make a phone call, and I had to call my neurologist because I fell last week. And so part of the migraines and the disorder with that and me being older and falling is a problem. So I called on the 18th, and I had so much anxiety since that fall that I wouldn't open my computer to go and check the email to see if they even responded. I don't know why I wouldn't do it. I was just afraid to do it. And so finally, I go into my computer today, open the computer, I go to my chart, and I tell them what's going on. And they answered me back immediately. And they said, because of the complexity of what's going on with you, you need to see a doctor right away. Make an appointment to see the doctor. If you don't see the doctor, see a nurse right away. So I sat there and I typed, my little thing to the nurse practitioner. That was going on. And as I was writing, I became more nervous and more nervous and more nervous and more upset and more upset and more upset. And then when I closed the computer, I got up and I started to pace the floor. And I was like, okay, I gotta do this. Now, I went to that doctor, and this doctor sent me to that doctor, and this one, that one, and I had that report and this report and that report. And then my mind just started to go. And I just started shaking. And then I just said, okay, calm down. And I started to breathe. And I said, okay, I'm going to go outside. I'm going to sit outside, and I'm going to just breathe. I'm just going to meditate. And something triggered that reaction for me calling the doctor. And I had to figure out what it was that was making me so anxious. And this is what I'm talking about, triggers, and when we have problems from childhood that we grow up with, and we don't relate them to events in our adult life that we go through. Abuse in childhood, trauma, makes us ill later on in life, makes us mentally ill if we don't deal with it. One of the things that when I went to the psychiatrist for, when I was at the neurologist said, okay, it's time for you to go to the psychiatrist because you're not getting any better and we don't know what's going on with you. You have to see the psychiatrist down the hall. So I go to the psychiatrist down the hall. I'm talking to him, and he says, so, what's going on with your childhood? How was everything? I said, oh, I had a good childhood. And he said, well, really, how was it? And I was like, well, I grew up with, my stepfather. Our parents were divorced when I was young. He said, well, how old were you? And I was like, I don't know, maybe 4 or 5 or 6. I said, my father left when I was 7. He called, he came over one day and said that he was leaving and he was never coming back. And I remember sitting on his lap thinking to myself, he's never coming back. And I remember looking into space when he said that, and I thought to myself, he's never coming back. And he never came back. And I never talked to him again until I was in my 50s. And he looked at me, and he said, and what else? Like I didn't say anything. And I said, well, I said I was in, school. I didn't have I didn't get good grades, and I had a really hard time in school. I struggled in school. I'm dyslexic. I think I'm dyslexic. In fact, I know I am. And I said, I always got bad report cards. Every time I came home with a bad report card, I got a beating. And he said, really? Tell me a little bit more about that. And I said, yeah, well, all black parents beat their kids, you get a whooping. And he said, uh-huh. So tell me more about that. And I said, well, and I flunked the first grade. And my teacher said that I daydreamed, that I looked out of the window all the time, that I didn't pay attention to the blackboard. So when I got home, every report card, when I came home from the first grade until almost the 7th grade, I got a beating every report card. I'm not talking about a whooping. I'm talking about a beating. And to the point where I don't even know where my mind went after I got a beating. I can't remember. So and my mom was a good mom. Like, I love my mom. And I just thought it was normal to get a beating after you say, you better learn. You better learn. You can learn. You better learn. And so during that time, I taught myself how to read. I would sit in the dark. Like you see those kids, under the covers with a flashlight. I taught myself how to read. When I taught myself how to read, I was like in the 6th and 7th grade before I grasped it. Once I did grasp how to read, I was good, but still there were a lot I didn't comprehend as well. So it was a struggle all the time for me. Even my first year of college, I was flunking everything until my English professor took me aside and they tested me. And they said, you're dyslexic and you're ADHD. Sit out, take one semester, one class. Just take one class off your card and just take 3 instead of 4 because you're flunking everything. And when I did that, I was in the dean's list with just 3 classes instead of 4. I said, well, how long is it going to take me to graduate? And they said 7 years. When they said 7 years, I was like, oh my God. I left. I stayed in school for like 2 more years and struggled. Then I dropped out and went to California. 7 years seemed like an eternity. But I was lost. I was like, oh my God, what am I going to do with my life? This is crazy. However, he told me that I was a gifted writer. After he told me to stop thinking about the grammar, he read something that I wrote, but it still did not register because I had been beaten all my life growing up when I got the report card. So I never thought that I was gifted at anything. Even though I got A's and B's in art, it didn't matter because I flunked everything else. So I'm like really creative, like an artist. I do all kinds of artistic things, but don't believe that I am a good artist. It's a belief thing. Now, on the other hand, that I have my own mind and I know how the mind works, now I believe I'm an excellent artist. Like my greatness, my excellence, all of that I can see. But it took so much work. So much therapy, all of that. And it came all flowing back to me when I think about going to the doctor. When I was younger and had to go to the doctor, I had a concussion when I was 12 years old, 13 years old, and I had to go to the doctor. And here I am with a concussion again, and I'm going to the doctor. And all of that stuff just came flooding back in 2 seconds. 2 seconds, all of the abuse, all of the trauma, all of that just came back. And I just lost it. And so that's what a trigger is for anxiety. Because you carry that stuff with you and you think that you don't. And I did personal development classes and all that kind of stuff. It changed my life and whatever. And it worked. I made a lot of changes in my life. At some point, it's like, okay, I know all of that is good. When something happens in that moment, in that second, it goes away. And you have to remember who you are. And when you remember who you are, and that all of those things are not true, and you pull yourself together, after you call a friend and say, I'm having an anxiety attack, and they go, are you okay? And I go, yes, I'm okay. Once I do that, then I'm good. But it's difficult and it's challenging. So this is what I'm saying about bipolar. So when you go to a doctor and they can't diagnose you, and it takes them a long time, it's because they have to go through your whole life. and they have to talk to you, and they have to analyze you, and they have to figure out what's going on with you, what happened to you when you grew up, what kind of trauma did you have? Did you have emotional abuse? Did you have physical abuse? How long? What kind of abuse was it? All kinds of stuff goes into the pot. And so that's the thing that got me today, and I had to figure out what it was. So I spent all that time telling you about that physical abuse was something that I stuffed down and never wanted anybody to know about me. Nobody could ever know that I could not read, could not write, that I got a beating. Oh, by the way, the psychiatrist said to me after I told him, he said, you got a beating every report card? I said, every single one. He said, until you were how old? And I told him, and he said, that's child abuse. And I said, what? And he said, yeah, that's child abuse. And I was like, thinking to myself, no, it's not, because all the kids come to school saying, my mom beat me with an electric cord, my mom beat me with this, or my mom beat me with that. All the kids that got bad report cards. So I was not thinking that it was child abuse. So once it registered and I had to sit and be with it for a while, that was really, really hard to digest. It was really, really hard to digest. And then I had to look around at my family and the way everybody was being treated in the family. And we were all treated differently according to our deeds. So, it was a difficult moment. But I managed to have a good day because I started making jewelry. So, whenever I need to calm down, I just pull out my jewelry, which is all over this, on the other side of the camera. It's all over the place. If I turned the camera around, you would go, oh my God. But you would go, oh my God, that's how she makes her jewelry? So one day I'll show it to you. So I sat down and I started making jewelry, and I took out some of the other stuff, and then I started posting some of the jewelry for whatever. And it was a good day because that made me feel good about myself to create something, the art and the creativity that I didn't have permission to do when I was younger, or appreciated for, or had any recognition for. Nothing like that. So I just want you to think about your triggers. What are the triggers for you when you were growing up? What happened to you? That's one of the things that Dr. Gourmet Mata says. He treats patients specifically for trauma. You have to have a different therapy for trauma than other things. So whatever kind of, therapy you need. He says specifically trauma is very different. He said, when you look at somebody and you see that they're out of sorts, and you see that there is a problem, somebody is saying something and doing something, and you're just looking, and you're just going, oh, they're crazy, I'm not dealing with them. Look at that person, oh my God, what is wrong with them? Don't ask what's wrong with them. You ask what happened to them. And when you ask what happened to them, it changes the conversation. And what it also does is it changes your heart, because you don't know anybody's story. And once you know somebody's story, you're going to have some compassion. Now, some people don't have compassion. Those people would be narcissists, sociopaths, and psychopaths. They can't be treated. I've seen psychologists and psychiatrists talk about trying to treat a narcissist, a sociopath, or psychopath, and they say they're the only ones that don't think there's anything wrong with them. And they're the ones who can cause a lot of problems in your family. So if somebody's called you a narcissist or a sociopath or a psychopath, check yourself. Anyway, so I'm going to go because it's I think I'm 20 minutes, almost 20 minutes. So I've talked about the trigger of anxiety. what I did to calm myself was to go outside, meditate, to breathe, to understand that my perception of myself is not who I am, that perception of the child of not being smart enough, being dumb, the abuse. My mom did the best that she could. She really did. She did the best that she could. And she disciplined me the best way she knew how. And so my perception of her discipline is not exactly what it was. It's my story of how it was. So my mom was very wise, gave me a lot of good advice, but the effect of the abuse has been long term. It's been long term. So what I want to leave you with today is I posted on Instagram on my bookshelf right there, my corner of courage. And it's the books that I keep right there on the side. One, I write my prayers in every day. I write what my prayer is and what my intentions are for the day. And I have a little gratitude book. I write 3 things that I'm grateful for every day. And then I have my spiritual books. I have one that is the 4 Agreements that everybody should read, The Mastery of Love, and a few other books right there. One that my best friend wrote, I'll always keep it there because she's an excellent writer and I love her, so I keep it there so I can look at it, and I flip through it every now and then. So, I keep those books there right at hand, so I can just pick them up at any time whenever I'm feeling any type of way. But most days I'm feeling great, only because I get help and I have friends that I can call when I'm feeling some type of way. So my prayer for you today is that I want you to know that there's help for you. There's always help for you. And that when you're feeling really awful and you don't want to get out of the bed, I want you to get up, go outside, and go for a walk. Exercise is the best thing you can do to get some fresh air when you come back in. I want you to call a friend, call somebody, and talk to them. And if you've been diagnosed with bipolar disorder, I want you to stop hiding it and tell one of your family members that you've been diagnosed and confide in them. You don't have to tell everybody, but do not hold it in anymore because it's toxic and it's making you sick. So if you're bipolar and you're ill and you have a physical ailment and you haven't told anybody, it's probably because it's already made you sick. So, your next breath is not promised. So, I want you to be loved, know that you are loved, and I want you to be well. Okay, so I'm going to find my clicker. Wish you love, life, and peace. Oh, and yesterday I looked at my the video. I said everybody's name wrong. I made so many mistakes, but that's because I just talk off the top of my head. So bipolar is manic and depression, not euphoria and manic. Now I realize that's what I said, but anyway. But if you guys are reading anything about bipolar, then you'll know that I made a couple of mistakes, but you can just do a fact checker on me, okay? So anyway, one thing is if you're in a family that is really, really toxic and you've been there a long time and you just like hate where you are, there's a saying, if the house is on fire, the house is burning down, get out. Okay, love and light. And I am Winter with Bipolar, Bazaar. You guys have a great one. I love you. Take care. Here's the clicker. Let's see if it works. I think I might have to double click. I'll try that this time, okay? Does it work? Nope.